Hello, good afternoon everyone. So today we're going to discuss about mumps, hepatitis A and hepatitis B vaccine breakthrough. So this is our learning objectives. So for this discussion, we are able to know the different vaccines under its brand name for the illness such as mumps, hepatitis A and hepatitis B. Then discuss the history and characteristics of each of the vaccines. And lastly, identify the type of vaccine, its indication, dosing, contraindications, and side effects. So this is all about mumps vaccination. So what is mumps? Mumps is best known for the puffy cheeks and swollen jaw that it causes. This is a result of swollen salivary glands. Actually, yung swollen yung salivary glands natin, it is also known as exocrine glands that produce saliva through, through the system of ducts. So we humans have three paired salivary glands. So these are called parotid salivary glands, submandibular salivary glands, and sublingual salivary glands. So yung parotid salivary glands natin, ito sila yung pair of mainly serous salivary glands located below and in front of each ear canal. Then yung submandibular natin is the second largest of the three main salivary glands. So they lie in the submandibular triangle. Then lastly is the sublingual salivary glands. So it is situated underneath the tongue. So ito sila yung located sa ilalim ng ating tongue. So it is sometimes referred, yung mumps natin is sometimes referred to as parotitis when it infects the parotid salivary gland that is located in front and below the ear. So when we say titis, diba, it is associated with inflammation. So yung inflammation sa ating parotid salivary glands, it is called parotitis. So next. So the mode of transmission of mumps. The virus is spread by respiratory droplets. These can become airborne when an infected person coughs, sneezes, and talks. So ayun no, it is very contagious kasi siya, through droplets. Yung makuha mo siya sa coughs, sa yung pag-ubo natin, pag-sneeze, pag-singha, and also sa pakikipag-usap, so makuha din natin siya. A person can contact the virus by touching the surfaces that are contaminated with infected droplets. So ayun, halimbawa yung mga gamit, bawa yung ballpen, hinawakan ng infected person. Kung mag-expose ka din doon sa ballpen na yun, hawakan mo yun, then matouch mo siya, tapos inhale mo or something. So, there's a big possibility na magiging infected ka rin. Then, infected individuals are considered most contagious during a period starting several days before the appearance of parotitis, if it occurs, and running through a fifth day after it first appears. So, ayun. To keep the patient from spreading the virus to others, isolation is recommended for 5 days after parotitis begins. So, kung alam mo na infected ka sa virus, so you should isolate yourself na for 5 days na after na napansin mo na may pamamaga niya. So, yung talaga dito is kailangan mo i-isolate talaga yung self mo, tapos maging clean. So, cleanliness is the key. Ayun, yung transmission of mumps infection, ito nga yung sabi ko kanina, yung through coughing, sneezing, talking, sharing drinks or eating utensils with others, touching objects with unwashed hands that are also touched by others. So ito yung mode of transmission, kung paano mo siya ma-acquire. Then symptoms and causative agent. Mumps is caused by a virus from the genus Rubella-virus or the family Paramyxoviridae. Symptoms typically occur 2 to 3 weeks after exposure to the virus. After an incubation period of some 2 to 4 weeks, mumps begins with non-specific symptoms such as myalgia, headache, malaise, and low-grade fever. Within days, these symptoms are followed by unilateral or bilateral swelling. When we say unilateral, meaning isa, uni, single. Bilateral or dalawa, bilateral swelling. So, mas malaki. Of the parotid salivary glands with other salivary glands. So in most people, mumps is pretty mild, but it can cause serious long-lasting problems, including hepatitis or the swelling of the testicles in males, oophoritis, swelling of the ovaries, and or mastitis, swelling of the breast in females. Then encephalitis, swelling of the brain, meningitis, swelling of the tissue covering the brain and spinal cord, and loss of hearing, temporary or permanent. So, ayun. Yun yung mga serious, long-lasting, and mild problems na mak-acquire natin if we have mumps. So, in very rare cases, mumps is deadly. So, very rare din naman. So, kahit na, kailangan pa din natin umiwas sa ganitong sakit. We cannot, definitely maiwasan, but, we can, prevent. We can prevent them. The transmission. Basta yun. Then, next is mumps vaccines available. So, live attenuated mumps vaccine based on the live attenuated virus strains, including the Gerilyn, RIT 4385, Leningrad 3, Leningrad Zagreb, Urabe, AM9, S79, Rubini, and others have been available since the 1960s. So, available na pala yung vaccine para sa mumps since 1960s. However, due to the low level of seroconversion obtained with the Rubini strain, World Health Organization or WHO has recommended that this strain should not be used in national immunization programs. These vaccines are produced by growing the virus in cell cultures or in embryonated chicken eggs. The virus is then purified, formulated with stabilizers such as gelatin and sorbitol, and lyophilized. Mumps vaccines are available as a monovalent vaccines, a bivalent measles mumps vaccine, or as trivalent measles mumps rubella vaccines. So, monovalent, yung contain, isa lang talaga na para sa mumps na talaga. When we say bivalent, dalawa na para na sa measles and mumps. So, yung trivalent, so measles, mumps, and rubella na. So, para na siya talaga sa tatlo. So, yan. So, vaccines brand name. So, ito yung mga mumps vaccines under the brand name of ProQuad, MMR, Mumps Vax, Priorix, Leningrad 3, Leningrad Zagreb, Urabe AM9, S79, and Biovax 2 or type 2. So the short history and characteristics. The live attenuated mumps vaccine used today in the United States was licensed in 1967. It was developed by the prolific vaccine researcher Maurice Helleman using mumps virus that he isolated from his daughter, Jerry Lynn, when she was ill with mumps at age of 5. The vaccine virus strain is referred to as the Jerry Lynn strain. Halleman's mumps vaccine was then used in the combination of measles, mumps, rubella vaccine, so trivalent siya, which has licensed in 1971. The rubella component of the vaccine was changed in 1979, but in the United States, the mumps and measles vaccine viruses have remained the same since 1971. So ayan, a brief history lang ng ating mumps vaccine. So ang ating mumps vaccine is a type of live attenuated vaccine. So mumps indication. So mumps vaccine indication, all infants age more than 12 months of age. So they are pwede na sila mabaksinan or maka-avail ng vaccine. Susceptible adolescents and adults without documented evidence of immunity. Yung mga walang mga immunodeficiency, yung tawag ba din. So ganun yung mga hindi weak ang immune system. So sila yung pwedeng mabaksinan or pwede i-vaccine. So itong vaccine, mumps vaccine, it doesn't protect people as long as it needs to. It only lasts for an average of 27 years. So it is according to the new study in Science Translational Medicine. So kumbaga, after natin makakuha ng vaccine, hindi siya talaga guarantee na hindi na talaga tayo makakuha ng mumps. So actually, it lasts for 27 years. So pagdating ng approximately 27 years, meron pa din na possibility na makaka-mumps tayo ulit. So, kung i-question natin na if makakuha ba tayo ulit ng mumps after being vaccinated, the answer is during mumps outbreak kasi people who have been vaccinated can still get the disease. This is especially true if one didn't receive both doses of vaccine kasi yung sabi ko then may dalawang doses kasi ito siya na dapat makuha ng isang tao. So however, symptoms and complications are much less severe in people who are vaccinated compared with those who aren't. So ayun nga, syempre kahit na ma-expose ka, at least na bawas-bawasan yung complications kaysa doon sa mga hindi talaga naka-avail or nakapag ng vaccine. So yun nga, children get 2 doses of MMR vaccine starting with the first dose at 12 to 15 months of age and the second dose at 4 through 6 years of age. Children can receive the second dose earlier as long as it is at least 28 days after the first dose. Adults who do not have presumptive evidence of immunity should get at least 1 dose of MMR vaccine. Certain adults may need 2 doses. Adults who are going to be in a setting that possess a high risk for measles or mumps transmission should make sure that they have 2 doses separated by at least 28 days. These adults include the students at post-high school education institutions, the healthcare personnel, and the international travelers. So ito sila. So meron tayong 2 doses. Yung first dose at saka second dose. Yung first dose natin pwede siya from 9 to 15 months, and the second dose from 15 to 6 years old within 4 weeks between doses. So dapat kasi more than 4 weeks siya magpa-vaccine ulit para maging effective daw yung ating vaccine. So that is according to research. Contraindications. Severe allergic reaction to vaccine component of the following prior dose. So, syempre, kung may sa first dose pa lang, if may naramdaman ka na ng allergic reaction, so of course, hindi ka na mag-ulit kasi baka maging mas ma-complicate pa yung allergy reaction na nangyari. Then second is pregnancy. So yung mga pregnant woman is bawal. Has weakened immune system due to disease such as cancer or HIV/AIDS, or medical treatments such as radiation, immunotherapy, steroids, or chemotherapy. So, syempre, yung mga taong merong immunodeficiency or has weakened immune system, and of course, yung mga nag-undergo ng medical treatment is hindi sila pwede na mag-vaccinan. Makakuha ng vaccine. Then primary or acquired immunodeficiency states. Has ever had a condition that makes them bruise or bleed easily? Yung mga taong madali masugatan, tapos marami masyado yung dugo na lumalabas sa kanila. So hindi din sila pwede. Has recently had a blood transfusion or received other blood products. So yun, yung mga taong naka-receive ng blood transfusion, so bawal din sila. Then, yung person na may tuberculosis has gotten any other vaccine in the past 4 weeks, live vaccine given too close together might not work as well. So, yun yung sabi ko kanina. Dapat yung interval ng mo ng vaccine is more than 4 weeks para maging effective. Kasi, kung hindi siya more than 4 weeks, may tendency na hindi mag-work yung vaccine. So, lang siya. Parang wala lang effect. Then, yung mga moderate or severe acute illness. So, kung yung person is, merong headache, mga muscle pain, ganun, is hindi din sila pwedeng na makakuha ng vaccine. Or they are not, basta hindi sila pwede ma-vaksinan. So, side effects. Mumps vaccine side effects are sore arm from the injection, fever, redness or rash at the injection site, swelling of glands in the cheeks or neck. So, fact, did you know na sa Ghana, yung country na Ghana is the top country by mumps, yung mataas na rates ng mumps sa kanila. And yung sa symptoms pala, yung diagnosis, it is based on swollen salivary glands, as what I have said earlier. Pero kung yung mga other symptoms, hindi nag-appear, like yung swollen salivary glands, the doctor will perform a virus culture if ever na may ma-observe siya na symptoms other than pamamaga ng ating salivary glands. So a culture is done by swabbing the inside of the cheek. So ayun, pagsaswab ng inside ng ating cheeks. So magpuha tayo doon sa ating salivary glands, tapos itatest natin. Itatest ng doctor. So ayun. So, yun lang para sa mumps vaccine. So, next is hepatitis A vaccination.
Hello everyone. So our next topic is all about the hepatitis A vaccination. So what is hepatitis A? So this hepatitis A is a liver disease caused by this hepatitis A virus, or they call it the HAV. It is highly contagious in which madali mo lang ito makukuha when you are in contact with the infected person or kahit na sa food that you are preparing. And this hepatitis A can affect anyone. Yan yung sinabi ko kanina. And we have this available vaccine na long-term prevention for the hepatitis A virus. In fact, infection in a person 1 year of age and older. Having a good personal hygiene, sarili mo or proper sanitation, this also help in prevention in the spreading of hepatitis A. So even just in a simple way, makakatulong tayo to prevent this kind of virus. So next, please. Okay. So in that transmission or exposure of the hepatitis A. So how it is spread. So this virus actually found in the stool or they call it the poop or the blood of the infected person. So even just in a small amount, if this virus is ingested by a person, magkakaroon ka talaga ng hepatitis A virus. So, paano nga? So, number one is person-to-person contact. Kaya nga sinabi ko kanina na it is highly contagious kasi makukuha mo to kapag you have in contact with the infected person na may hepatitis A virus. Example is through certain types of sexual contact like oral or anal sex. And also for if you are caring for someone who is ill na merong sakit ng hepatitis A, may big possibility na pati ikaw is ma-infect din. And also, if you are using drugs with others or with a syringe, di ba? Kapag nag-share-share ka ng share syringe with the infected person, pwede yun. And hepatitis A is very contagious. Kaya, yun yung sinabi ko kanina. And people can even spread the virus before they feel sick. And then number two, eating contaminated food or drink. A contamination of food with the hepatitis A virus can happen at any point, even you are growing a plant, harvesting your gulay, fruits, in, in just a simple way of handling, or after you are cooking, yan, may possibility na ma-infect yung or ma-contaminate yung food. The contamination of food and water happens more often in a countries where hepatitis A is common. If a certain country is mataas yung rate ng may mga hepatitis A virus, then there's a big chance talaga na ito yung just like the food na na makontaminate. So ang uncommon naman is the foodborne outbreak na na-happen in the United States from people eating the contaminated, fresh, and frozen imported food products. Okay, next, please. So let's move to the symptoms of this hepatitis A. Not everyone with hepatitis A has symptoms. Sila yung mga tao na carrier but they are asymptomatic. So, adults are more likely to have symptoms than children. So, mas makikita talaga yung mga sign and symptoms sa mga adults. Usually, if the symptoms develop, it appears in the 2 to 7 weeks. if you are infected by the virus, but it lasts only less than 2 months. However, there are some people na yung range ng kanilang sakit is mas aabot ng 6 months. So here are the list of symptoms of this hepatitis A. Just example is here is the yellow skin or you have a yellow eye. So let's take a look in the picture, the screen, yan. And number 2 is not wanting to eat or you have a loss of appetite. Number 3 is upset stomach. Number 4 is throwing up or vomiting. Yan. And number 5 is the stomach pain. Number 6, the fever or you have a high temperature. Number 7, you can have a dark urine or light colored stools. Number 8 is diarrhea. Number 9 is joint pain. And number 10 is feeling tired. If you have this all symptoms, it's better na mag-consult ka na sa doctor mo para hindi na mas maglalayo yung sakit. Next, please. Okay, so the hepatitis A vaccination is all about the vaccination. So let's go back into the history and its characteristics. The discovery of hepatitis A virus, its propagation in the cell culture and cloning of its gene culminated almost 2 decades later in the development and licensing of an effective vaccine. So in this discovery, the first nila na ginawa is there is a propagation in the cell culture and then cloning and then after 2 decades naman, may another na naman sila na development and licensing for the effective vaccine. So according to the WHO, the most effective way to prevent hepatitis A virus infection is to improve sanitation and immunization. Just like kung sinabi ko kanina, if you have a good um, sanitation, pwede ka na mag-prevent, it can help to prevent the spreading of this virus. And also, the immunization for the infant is important. Gamma globulin was found to be effective in prevention of measles in susceptible household contacts in the year 1944. So the gamma globulin is they um they discovered that it has an effective in prevention of the measles. And Joseph Stokes naman, he is a pediatrician working at the University of Pennsylvania School of Medicine, used the knowledge in curtailing hepatitis A outbreak among children by administering gamma globulin. So this gamma globulin, yun yung ginamit ni Joseph Stokes in the outbreak of hepatitis A among the children. So the first hepatitis A virus vaccine was developed in early 1990. So matagal na pala siyang na-develop. In 1991 is a preliminary study was published among vaccines demonstrating neutralizing antibodies following the administration of formalin in activated vaccines. Live attenuated hepatitis A vaccine was developed subsequently. Okay, so next please. Currently, vaccine available internationally. So these are the type of vaccine na available internationally. So number 1 is formaldehyde and number 2 is live attenuated vaccine. So this formaldehyde is an inactivated hepatitis A virus vaccine are used in most common countries. So monovalent inactivated hepatitis virus vaccine are available in pediatric dose, yung mga BTs, in which it is 0.5 ml and available din siya for the children aged 1 year to 15 years old and available din siya for adults. So, pangkalahatan talaga. And then number two is the live attenuated vaccine in which it is manufactured and used mainly in the China and sporadically in the private sector in So take note, this live attenuated vaccine is manufactured by China. And the Chinese live attenuated hepatitis A vaccine has been shown to be safe and highly protective as 95% against clinical infection for at least 3 years. So good, it is good talaga. And next, please. Okay, so let's talk about the number of doses of this hepatitis A vaccine. So in the inactive doses, it ha it needs to have a 2 dose sa pagtake ng vaccine, and for the is live vaccine is 1 dose only. For the schedule naman is the inactive doses, it needs 2 doses. For the second dose, normally 6 months after the first dose. For the live vaccine, 1 dose lang siya, hindi pwedeng dalawa kasi 1 lang. And it is minimum age in vaccination is 1 year. So the boosters is not necessary na gamitin. And number four, the contradiction. If you have a hypersensitivity to previous dose of this hepatitis A vaccine, you need to stop because baka it may harm you at hindi siya makatulong sa'yo. And for the adverse reaction, in the inactive vaccine, it from mild local reaction of short duration and mild systemic reaction, live vaccine is few reported. Okay, next, please. So for the before departure, if you have want to travel, ganyan, inactivated live and live vaccines, it is a protection achieved within 2 to 4 weeks after first dose. So mag-effect lang siya ang yung pag after ng first dose for 2 to 4 weeks. So given the long incubation period of hepatitis A average is 2 to 4 weeks. But the vaccine can be administered up to the day of departure and still protect the traveler. So there is still, if nagpa-inject ka, then it still protects the traveler from having an infect by the infected person. So next is the recommended for. It is recommended to take a shot of this hepatitis A vaccine for an individual's aged less than or equal to 1 year traveling to countries or areas with moderate to high risk of infection. This is for the mga infant. Yan. And to those at high risk of acquiring severe disease such that such as immunosuppressed patient and patient with chronic liver disease should be strongly encouraged to be vaccinated regardless of where they travel. Ayan. Okay, so next please. So here is the available vaccine for hepatitis A. The Havrix and the Vacta. So this Havrix is manufactured by the GlaxoSmithKline and this Vacta is manufactured by Merck. So these two available vaccines are both available for pediatric and adult formulation. Okay, next is, okay, so lastly, let's talk about the side effect and indication for this hepatitis A vaccine. So it has the side effects, it has two type, the mild side effect and the other reported side effects include. So here in the mild effect, number one is the soreness where the shot given. And number two is the headache, yung pagpananakit ng iyong ulo. And next is the loss of appetite, wala ka nang gana magkain, and also the tiredness ng pagod. And the following are the other reported side effects include allergic reaction after taking the shots, and the taste changes, if you feel like you're vomiting, ganyan, or you vomit. You have a sensitivity to light, you have a belly pain, nausea, seizures, and dizziness. So these are the possible side effects na you can attain if you have been injected by this hepatitis A vaccine. And lastly, the indication. So all children aged 12 to 23 months should be immunized by the hepatitis A vaccine. So for those na unvaccinated children and adolescents aged 2 to 18 years, so they need talaga na mag-vaccine ng hepatitis A para prevention na din. And for the international travelers, just like yung sinabi ko kanina, it is recommended talaga. And for the people who have occupational risk for infection. So, yun lang po ang lahat sa hepatitis A vaccine.